mentioned about making sure that people have information about what their plans cover. We all know, I mean, I've shopped in the individual private insurance market. It's impossible. As I say, we have all tried to shop in the individual private insurance market, and it's impossible to know. You think that you have coverage over one thing, and then you find out 2 months later that they don't actually cover that. You're wading through tons of different information written in incredibly complicated language. So one of the things that we really tried to do in the Senate bill is give people navigators that will help you navigate the healthcare system and the different healthcare plans available, whether that's through the phone, whether that's through the internet, and it's through certain centers that we're going to set up locally to help people understand what different options are available to them in common, plain language that we can all understand, those of us who aren't lawyers. It's absolutely something that's imperative for health reform, for folks to know exactly what plans they have, what coverage they can get, and they can know what they're buying before they buy it. We think that's incredibly important.
If you want to follow up on something, just please. There you go. The Tier 4 plan asks people to pay a percentage of the cost of their drugs as opposed to a fixed copay. So in certain biologic agents such as Enbrel, Humira, Remicade, you may be asked to pay 25% of the cost. With these drugs, it can range anywhere from $500 to $2,500 a month. And that effectively takes many of my patients out of the ability to get drugs that are life-altering. That's what the fourth tier is.
Most of them are capped at $2,500. Thank you.
All right. Just. We're going to try to restrain ourselves, and then we're going to move the people. Gloria?
The question I have goes back to infant mortality, and the way to improve that or to decrease that rate is to improve women's health and to improve access to health care. One of the recurring things that we see when we are reviewing infant deaths is that the mother had some type of mental illness. What, if anything, is in the bills that will improve access to mental health services or mental health care?
I want to draw a distinction between coverage and access, because it does cover. You know, in the House bill, certainly mental health is covered. And we've made tremendous progress, I think, both in the state of Ohio and in the federal government in passing mental health parity. Mental health, look, folks, mental health. If you have a chemical imbalance in your liver, it's liver disease. If you have a chemical imbalance in your brain, it's mental health. As if that's somehow different. As if that's not still somehow a disease. And so we cover that in the House bill, and I'm happy that we do. But when we talk about access, we're talking about something completely different. And we continue to have a challenge. And none of the bills fully address the challenge we have in preventative care and basic wellness, primary care, access to primary care. We know that there are fewer and fewer primary care physicians coming out of medical schools. This is a crisis. It is not enough to cover everybody, because that doesn't mean access to primary care. You can be covered all you want, but if there's no primary care physician for you to go to, or they won't accept your plan, as is often the case in Medicaid, you don't have access to primary care. And so you seek your care in the emergency room. That is a critical need in many of our communities. Many of us are working on issues with regard to incentivizing primary care physicians coming out of medical school and looking at the debt that they bring out of medical school and trying to alleviate that debt to encourage them to go into primary care.
I just want to address this question quickly, since preventable newborn prematurity is something that Senator Brown cares very deeply about has actually worked with a program in Mansfield called CHAP, which has tried to bring down low birth weight babies among teenage women by getting them into doctors, doing neonatal care, newborn screening, and all the rest. And you're absolutely right. I mean, we need to have more money for community health centers, which we have in the Senate bill, with quadruple funding for community health centers, which oftentimes serve underserved communities and other areas where women just aren't getting care because they can't find someplace to go. And we also increase access. We have grants for mental health care specialists. We have grants to help individuals get transportation to programs where they can get the services that they need. So it's absolutely something so imperative. I was at Cincinnati Children's last week, and in the neonatal intensive care unit where they have the 1 pound and the 2 pound babies that the doctors were saying they could have been prevented if the women and the mothers had proper newborn care. And these babies, most of them are doing pretty well and will probably live, but they're costing the system $5,000 a day to be in these intensive care units. And they have long-range problems, they have developmental problems, they have higher rates of asthma, all things that affect the healthcare system and their quality of life. And I think that's something we absolutely have to address in healthcare reform, and we're doing our best.
I wanted to get back to a question David Altman started, having to do with small business. As he alluded to, I work for a nonprofit, small corporation in the state of Ohio, and our healthcare costs have jumped about 25% per year. We're waiting for the bad news about what it will be this fall. And I wanted to know what is in both the Senate and the House bill that would help small businesses either try to maintain adequate health coverage or go another direction.
There are credits in the House bill for small businesses to help them provide coverage to their employees. However, I'm also concerned about the bill, and the CBO analysis suggests that this will be a benefit to small businesses, that far more small businesses will be able to allow their employees to for the business to either offer insurance or have their employees get onto the exchange and be covered. And credits are available through the bill to those businesses. However, and this is one of my biggest hang-ups in the bill, and I want to be crystal clear, I have issues with some of the parts of this bill. One of my biggest issues is the pay for with regard to small businesses. If a small business doesn't currently offer insurance, they will pay a surcharge in the bill. That's a graduated surcharge, eventually up to 8% of their payroll, depending on how large their payroll is. The bill, as introduced, starts that at $2,500. Or not $250,000, I'm sorry. $250,000, I got my zeros in the wrong place. $250,000. $250,000 is not a large payroll. Now, one of the ones that was reported out of Energy and Commerce increases that threshold to $500,000. That's an improvement. But I'm still concerned that a small business that can't currently afford to provide health care, obviously is making that decision for financial reasons, is going to be hit again under the bill with the surcharge. Finally, there is another issue with regard to small businesses, and that is the income tax. Because there is also an income tax as part of the pay for it in this bill, because the bill is in fact deficit neutral. That is, it doesn't further add to the deficit, but it's paid for. But in order to pay for it, you have to have both savings in the system as well as more revenue. Another part of the revenue is a tax increase on the highest wage earners. But if you understand the tax code, many small businesses are put together as S corporations. S corporations pay income tax. The individuals that own the S corporations pay the income tax. I'm concerned that that would be detrimental to small businesses. So I've been out working with small businesses and trying to get a feel for where they are. They're doing the math. Some believe they will be winners, some believe they will be losers under the system. I don't want to create a system that disincentivizes small businesses from offering health care to their employees.